Hi everyone, this is Rebecca Way, and this is a presentation for DEH302. So there is a large body of research indicating significant links between periodontitis and Alzheimer's disease. It is well known that periodontal disease is linked with many systemic conditions, including cardiovascular disease, diabetes and insulin resistance, preterm birth, and even erectile dysfunction. There are several research articles that suggest that periodontal disease's inflammatory response is the main source of increased systemic diseases, that including Alzheimer's disease. There were a few studies performed on post-mortem human brains, finding the same bacteria that's normally in a periodontal disease pocket, which those bacteria are noted below. These bacteria are considered opportunistic and they can pass the blood-brain barrier. That was shown in those post-mortem brains. So what is periodontitis? Well, in the United States, periodontal disease is one of the most common oral health concerns, preceding that of dental caries. In 2013, the CDC reported that 47.2% of Americans above the age of 30 had some form of periodontitis. That percentage is nearly half of the United States population. As the global population does continue to age, periodontal disease has become a significant public health concern and a burden on the healthcare system. As we know, there are many oral systemic links present throughout the body. What exactly is Alzheimer's disease? Well, Alzheimer's disease is also known as dementia. It is an advanced neurodegenerative disease categorized by the progression and permanent damage to the brain by losing the ability to communicate, learn, and remember the past. This inevitable cognitive decline eventually can lead to death. Is there a link between periodontal disease and Alzheimer's disease? If you look at the picture to the left, it does show a diagram of the bacteria linked with different oral systemic links and the mouth. The simple answer is yes, there is a link between the two diseases, and that causative agent is normally because of that inflammation and the opportunistic bacteria that's commonly found in those periodontal disease pockets. There were findings in post-mortem human Alzheimer's disease brain studies. Lipopolysaccharides were present from the periodontal pathogens, 3 of them right here noted. They were isolated. The pathogens did play a role in the progression of inflammation and Alzheimer's disease, as the opportunistic bacteria were able to cross that blood-brain barrier. There were higher levels of antibodies against several different bacteria that were detected in Alzheimer's disease patients compared to healthy controls. And also there was P. gingivalis present in the brain of mice when they were studied. There was a cross-sectional study performed with a small amount of participants. They were 38 cognitively normal, healthy people. Random sampling was performed with voter registration lists. They were evaluated at the New York School of Medicine. They did medical exams, psychiatric, MRIs, amyloid brain imaging, which is common for detection of cognitive decline. They also had a full mouth periodontal evaluation done that evaluated the plaque surfaces, millimeter probing depth call, BOP, and anything that was a call of greater than 3 millimeters was notated as being an active periodontal disease pocket, especially if bleeding was present. The reason they chose 3 millimeter calls was because in a previous study with cardiovascular disease and periodontal disease, it was linked with 3 millimeter calls and above. So the results determined that the actions of periodontal disease were associated with the amyloid buildup in the brain in areas that were more prone to accumulation. In patients that did have Alzheimer's disease, the results suggest that periodontal inflammation and infection may increase the risk for the deposition on the brain. There were findings that demonstrated that a 10-year periodontal disease exposure increased the risk of developing Alzheimer's disease by 1.707-fold. These findings do highlight the need to prevent periodontal disease progression and promote healthcare services at the national level. Patients with Alzheimer's disease do lack the ability to perform good oral hygiene habits or visit a dental professional routinely. Therefore, this does increase the risk of the development of periodontal disease. With this logic, it's assumed that maintaining good oral health could be a prophylactic measure of preventing the progression of Alzheimer's disease. In conclusion, there is a strong correlation between inflammation caused by periodontal pathogens and the increased risk of Alzheimer's disease onset and progression. That bacteria that's opportunistic can cross that blood-brain barrier. It also can colonize on the brain tissue, thus causing more inflammation to happen. Further studies should be performed to definitively link periodontal pathogens and antibodies against the pathogens with neurodegeneration in Alzheimer's disease patients, and also stressing excellent oral hygiene habits, the importance of routine dental visits, and educating patients on the possible links between perio and Alzheimer's, because maybe in the future it could help to prevent the progression of both diseases.